Hi, my name is Todd. If we haven't met yet, I've been doing this home care for over 10 years now. And if you're a new home health nurse, I welcome you. One of the trickiest and most important parts of the job is knowing when to escalate care or call the doctor. You're out there on your own and it can feel like a lot of pressure. So let's just take a moment and walk through how to handle things with confidence, especially when things go south. First things first, it's completely normal to second guess yourself in the beginning. We all have. You don't have a crash cart or a hall full of colleagues like in the hospital, but you do have your assessment skills, clinical judgment, and backup when you need it. You can always call a supervisor. There's a simple mental checklist that I kind of go through myself. I call it the rule of 3 questions that I ask myself. So when I get into the situation, is this a change from the baseline? Could this harm the patient if I wait? And number 3, if I was the doctor, would I want to know about this? And if you answer yes to any of these, well, it's a pretty good idea to go ahead and call the doctor. Some situations almost always warrant a call. And of course, that's dealing with sudden shortness of breath, chest pain, or oxygen saturation that's way below baseline, new or worsening confusion, uncontrolled pain, signs of reaction, fever, discharge of wounds, falls, high or low blood pressure that's way out of normal, and missed medications or dosages that is causing critical problems with insulin or blood thinners. But when in doubt, document, and I always call. If you decide to call, have a few things ready: the patient's name, date of birth, and why they're on service. A quick summary of what you're seeing, what you've already done or tried, and what you're asking for, such as specific doctor's orders or any change or adjustments. But I use the SBAR, situation, background, assessment, and recommendation. If you're not sure whether it's worth a call, I wouldn't sit on it. I always call. Call a supervisor. The home health care team is there to support you, and it's always better to call than to not. I've always known that. And then when things are really bad, I go straight to 911 and just call the ambulance. Well, here's the truth. You won't always get it perfect, but none of us do. But if you lead with safety through assessments and good communication, and you're already on the right track, trust yourself. And remember, asking for help doesn't mean you're weak. It means you're smart. You've got this. If you have any questions or comments that you'd like to talk about, put it down there in the comments. I'd love to hear what your thoughts are. I certainly don't know everything, but I certainly would like to help out wherever I can. Well, thanks for stopping by and getting this far through the video, and we'll catch you on the next one.